Mushrooms versus cancer. Cutting edge. Mycology research. What if the cure for cancer isn't hidden in a pharmaceutical lab, but quietly growing on a decaying log in a forgotten forest? It might sound like something out of a fantasy novel, but cutting-edge research in medical mycology, the study of fungi, is pushing us closer to that possibility than ever before. For decades, mushrooms were dismissed as humble vegetables or psychedelic curiosities, but scientists are now uncovering compounds inside them that show powerful, targeted anti-cancer effects. This isn't fringe science. This is real, peer-reviewed, lab-tested research that is turning heads in the global oncology community. Stick with me, because what you're about to hear could change how we think about cancer treatment forever. Let's start with a mushroom that's already made its way into cancer hospitals across Asia: turkey tail. This unassuming fan-shaped mushroom, common in forests worldwide, contains polysaccharopeptides, complex sugar protein molecules that exhibit remarkable immune-modulating properties. In multiple clinical trials, turkey tail extract has been used alongside chemotherapy to boost immune function in patients with breast, colorectal, and gastric cancers. One Japanese study showed patients taking turkey tail had significantly better 5-year survival rates. Imagine empowering your body's own defenses with the help of something that grows on tree bark. That's the quiet power of fungi. Then there's reishi, also known as the mushroom of immortality. Reishi has been used for thousands of years in traditional medicine, but only recently have we begun to understand its anti-cancer mechanisms at the molecular level. Studies show that reishi extracts may inhibit tumor growth, prevent metastasis, and even trigger apoptosis, cancer cell suicide, in certain lines of leukemia and breast cancer. That's right, the mushroom literally tells the cancer cells to self-destruct. What makes it so compelling is how it does this while supporting the body's healthy cells, reducing inflammation, and lowering oxidative stress. Reishi is not a magic cure, but it's proving to be an extraordinary support tool for patients undergoing traditional treatment. And with no toxic side effects, it's one of the most promising natural adjuncts in integrative oncology today. One of the most exciting developments comes from cordyceps, a parasitic fungus known for boosting athletic performance. But now it's being studied for its cancer-fighting compounds. Cordycepin, a nucleoside derivative found in cordyceps, has shown promise in suppressing the growth of multiple cancer cell lines, including lung, prostate, and breast cancers. It works by interfering with the cell's RNA synthesis, essentially scrambling the cancer's ability to replicate. What's fascinating is that this compound is highly selective. It targets cancer cells while leaving healthy ones untouched. For researchers, that's a holy grail, a therapy that attacks the disease, not the person. While human trials are still ongoing, the laboratory data is electrifying. Cordyceps could become the basis for a new class of targeted cancer drugs, and it all started with a fungus that infects caterpillars. Now let's talk about chaga, the black charcoal-looking mushroom that grows on birch trees and is bursting with antioxidants. Chaga has been used for centuries in Siberian and Northern European folk medicine, and modern science is beginning to validate its reputation. Rich in betulinic acid and melanin, chaga exhibits strong anti-proliferative activity against liver, colon, and breast cancer cells in vitro. What's even more impressive is how it seems to protect DNA from damage caused by radiation and oxidative stress, two key drivers of cancer development. It's not flashy or exotic, but in terms of natural compounds with therapeutic potential, it might be one of the most powerful mushrooms we know. Don't overlook Mycology, the so-called dancing mushroom, which is already being used in cancer clinics, especially in Japan. Mycology contains a compound called diffraction, a beta-glucan that activates key immune cells like macrophages and natural killer cells, both of which are essential for identifying and destroying cancer cells. Clinical studies have shown that diffraction can slow the progression of tumors, especially when combined with chemotherapy, by both shrinking cancer mass and improving patient resilience. And it does this without adding toxicity or overwhelming the patient's body. In some cases, it even improves quality of life during chemo, reducing fatigue and nausea. Mycology isn't just food, it's functional medicine wrapped in a gourmet mushroom cap. Enter shiitake, often found in your stir-fry, but hiding serious medicinal muscle. Shiitake contains a compound called lentinin, which has been used as an immunotherapy agent in cancer treatment for decades, particularly in China and Japan. Lentinin enhances the body's immune response, stimulates white blood cell activity, and has been clinically linked to increased survival rates in gastric and colorectal cancer patients. Unlike many drugs that bombard the immune system with side effects, lentinin works harmoniously, elevating the immune response without overstimulating it. In many trials, it also improved patients' tolerance to chemotherapy, helping them stay on schedule with less fatigue. It's a clear reminder that sometimes the line between cuisine and medicine is thinner than we think. Even lion's mane, usually known for its cognitive benefits, is now entering the oncology conversation. Preliminary research suggests that its compounds, hericenones and arenosines, may have anti-tumor effects, particularly in gastric and liver cancers. These compounds appear to suppress angiogenesis, the process by which tumors form new blood vessels to sustain themselves. Cut off that supply line, and the tumor's growth slows dramatically. Patients suffering from chemo brain, that mental fog that follows treatment, may benefit from the neuroprotective properties of this mushroom, making it a valuable ally for both brain and body during cancer recovery. Let's not forget about psychedelic mushrooms, particularly those containing psilocybin. While they aren't directly anti-cancer in the traditional sense, psilocybin is revolutionizing how terminal cancer patients deal with existential distress, depression, and fear of death. In clinical trials at institutions like Johns Hopkins and NYU, a single high-dose psilocybin session has resulted in dramatic and long-lasting reductions in anxiety and depression among late-stage cancer patients. This doesn't shrink tumors, but it profoundly changes the patient experience. It gives them peace, clarity, and in many cases, renewed purpose. That kind of emotional and psychological support is an essential, if overlooked, part of cancer care. And fungi are now proving they can help heal the spirit as well as the body. Mushrooms are not a miracle cure, but they represent one of the most exciting and underexplored frontiers in cancer research. With ancient wisdom, modern science, and biotech innovation converging, fungi are offering compounds that do more than just fight tumors. They support immunity, reduce side effects, protect DNA, and even uplift the human spirit. In a world desperate for more humane, holistic, and effective cancer treatments, mycology may hold the key to a future where healing is more natural, more targeted, and more empowering. If this deep dive into the cancer-fighting potential of mushrooms opened your eyes, make sure to like, subscribe, and share this video. Because the future of medicine might just be growing beneath our feet. And the more people who understand that, the more powerful it becomes.